Hi, I'm Dr. Austin Fragomen at HSS. I'd like to show you how to do adjustments to an adult rail. This is a technique called lengthening over nail. For people who have a short femur, we're often using the internal lengthening nail to perform the lengthening. But there are people who cannot have the internal lengthening nail for various reasons. In those select cases, we will use this technique called lengthening over a nail. The way this works is a rod or a nail, which is the same thing, is placed into the hollow femur, and then an external fixator is placed around the nail. The bone is cracked, and then the external fixator is used to lengthen the bone, sliding over the rod, and that's the technique. So what I'd like to show you is how to do that adjustment. This is really meant for patients who have this device on and have any confusion at all about how to do the adjustment. We'll see how to put the wrench into the nut and turn it at the prescribed rate, and you'll see it's actually quite simple. Inside the bone, we have a nail, which is a titanium rod. Outside, we have our rail, R-A-I-L, rail. So that's our external fixator. This allows us to lengthen, and this provides internal support and allows us to take this off sooner. I'd like to go over how to adjust the rail. So what we do is a 90-degree turn 4 times a day. And a 90-degree turn is 1/4 of a millimeter. 4 of those turns is 1 millimeter. We distract at 1 millimeter a day. Take the wrench we give you in the hospital, and you have to find how it fits. So the wrench fits into this slot down here, and then we're going to turn in the direction of the arrow. Okay? We're going to put an arrow on the external fixator before you leave the hospital. And we want to turn 90 degrees. So 90 degrees is right there. Okay? So that's 1/4 turn. Now I'm going to come back later in the day, roughly 6 hours later, and find where it fits. Now you see it fits in a slightly different spot than we started last time. Okay? Now I'm going to go to 90 degrees, which is about there. So that's a 90-degree turn. Now you're going to come back 6 hours later. Now we're back to where we started the first turn. And I'm going to turn 90 degrees. Okay? And I'm going to come back 6 hours later. And this fourth turn is the same starting position as the second turn. And I'm going to turn it 90 degrees. Right there. Okay? And that will be done over the course of 1 day. And that's 1 millimeter, those 4 turns. Let's look at what happens up at the osteotomy site where we broke the bone. You can see that it's already separating. And I'm going to do some more rapid turning just for educational purposes. You can see the osteotomy site separate and the bone starts to lengthen. So, first you have to fit the wrench into position. Now the wrench wants to go here. It won't always fit in a flat position. So this is where I have to start. And I'm going to turn this 90 degrees. 90 degrees is a right angle. So it will be about like that. So I'm going to turn that 90 degrees is right there. Sometimes you'll feel a click, sometimes you won't. Okay? So that's 1/4 turn. Now I'm going to come back later. Now my wrench doesn't fit in the same place as it did before, so I need to find where it fits. It fits right there very well. Now I'm going to go 90 degrees. That's going to be here. So I'm going to turn my wrench 90 degrees, which is right there. That's my second turn of the day. I have 2 more turns to do. So I'm going to come back later in the day. I'm going to find my starting point. This is the same starting point as the first turn. And now I'm going to go 90 degrees again to about there.
That's 90 degrees. That's my third turn. Now my fourth turn, starting position will be the same as the second turn. So it's down here. I'm going to come to here, which is 90 degrees. That's 90 degrees. And that's 1 day's worth of turning.
So I think you can see that lengthening over nail is a pretty simple technique. The adjustment is easy to do. Following up regularly will be the key to success.